In Eye in America, we look at problems facing the country and possible solutions. One problem is affordable health care. It is the issue that has the government shut down right now. Jim Axelrod reports on a new option for affordable primary care.
Let's take a look.
In Bangor, Maine, Jeff Clark has something a lot of Americans do not. High marks for his health care checkup.
How did the expectation of what this experience would be like measure up to the reality once you were here?
If I was doing it in a dream, it was exactly like my dream.
Clark is a new patient of Allie and Brad Tuttle.
Scan the QR code.
Yep.
The husband and wife who started Apotheosis Health, offering something called direct primary care.
It is simplified healthcare. Me and you.
After a decade of working at cancer centers, Brad, a nurse, and Allie, a nurse practitioner, now offer an alternative care model that cuts out the insurance middleman.
Kind of going back to the family doctor feel, where you go in, you're not rushed, really develop that relationship.
For less than $100 a month, patients get the basics: physicals, blood tests, discounted prescriptions, and a patient-first attitude.
If you can only be seen on Saturday mornings, we'll make that work for you.
1/3 of Americans do not have primary care providers, which drives up chronic disease rates, hospitalizations, and late diagnoses.
A lot of cancer is preventable with screenings, mammograms, colonoscopies. If you don't have a primary care provider ordering these things for you, they're not getting done.
About a quarter of primary care today is done by healthcare providers who are not physicians, but instead nurse practitioners like Allie.
If your issues are complex, you need to see a specialist for that. Most things, though, can be addressed here.
A decade ago, there were 140 practices across the U.S. Today, there are nearly 3,000. For Danny Cotu, the Tuttles provide exactly what she feels she needs. And she was diagnosed with leukemia last year.
Do you feel in control of your health care?
Absolutely. Yes, I feel that I'm the driver and they're my co-pilots.
Plus, in an age of physician burnout, with relentless patient quotas to be met, this approach, say the Tuttles, is not just good for the patients, but good for the providers.
You gotta put it right here.
And their families.
It increases like a work-life balance for providers, and that's why we're here. Is we have 3 kids. We'd like to spend some time with them.
That's not something we hear a lot about these days from providers or patients. Satisfaction. For Eye in America, I'm Jim Axelrod in Bangor, Maine.